Hi, I'm Dr. Megan Knapp, and you're watching Ask the Expert. October is Menopause Awareness Month. In this month's episode, I'm going to discuss menopause, the stages of menopause, symptoms to look for, and what treatments are available to treat your menopause. So what is menopause? The official definition of menopause is 1 year of no periods, no bleeding, no spotting. So it's actually a retrospective diagnosis. You look back and realize you haven't had a period for a year. What would you expect the symptoms to be in perimenopause and menopause? Well, actually what is happening is that your body is running out of eggs. So your brain is sending a message to the ovary to push out eggs, and there's very few left. And so it's pushing your hormones up or down, and that's where you get your menstrual irregularity, or your periods are really unpredictable. At the same time, when your hormones are low, you're going to start feeling hot flashes, night sweats. It might wake you up from your sleep. You can't get to sleep, or you can never get back to sleep. You might feel really anxious. You might feel really depressed. And the symptom list is getting longer and longer. You need to start watching your symptoms and writing them down. And then if you are concerned that you have perimenopause or menopause, or you already know you've missed a year of periods and you're feeling miserable, you need to find a menopause provider who is willing to talk to you about the treatments. The treatments are wide and varied, but you have to understand this is a new journey in your life. And with that new journey comes new things. You can't expect that any one treatment is a magic bullet to make you feel like you were 35 again. You have to look at your lifestyle, we have to look at exercise, we have to look at diet, we have to look at stress reduction, and then there's many non-hormonal and hormonal treatments to help you through the transition and those treatment of symptoms. A very common question I'm asked, or a patient will mention, is that I have a family history of breast cancer, so I can't be on hormones. Did you know that's not true? One question I always ask first is, who had the breast cancer in your family? The stronger side is your mother's side, not your father's side. So if your father's grandmother had breast cancer, that's not really putting you at risk. What I'm looking at is if your mother had it, you have a sister, a cousin, or an aunt, and do you have more than one? Did they have genetic testing? Because only about 10 to 15% of breast cancer is actually with family history. So just because you have a history does not mean you can't take hormones. At the same time, you know as a patient, if you're going to start hormones, you're going to do a better job at screening for breast cancer by getting your annual mammogram than if you didn't. There are women who have had different types of procedures or on different types of birth control that they don't have a period. That makes it much harder to decide where they are in their transition. With that said, I wouldn't recommend someone to stop their birth control because we don't want them to get pregnant while they're trying to figure out if they're perimenopause. If you are experiencing symptoms of perimenopause or menopause, schedule a menopause appointment with a women's health care provider at North Shore by visiting northshorehealth.org.